So tell me what brings you in today.
Well, doctor, it's this cough. It started a few days ago and it just won't quit. I feel congested and my chest hurts.
I see. Have you had a fever or any other symptoms?
A bit of a fever, yes, and I'm tired all the time. Could it be bronchitis?
It's possible. Bronchitis is often caused by a virus similar to the common cold. It spreads through tiny droplets in the air when someone coughs or sneezes.
So someone at work could have given it to me?
It's certainly possible. Touching contaminated surfaces and then touching your face can also spread the virus.
I had no idea it was so contagious.
Bronchitis is an inflammation of the bronchial tubes, the airways that carry air to your lungs. When these tubes get inflamed, they produce mucus, which causes coughing.
So that's why I feel so congested.
Exactly, the virus is the most common culprit, but bacteria, smoke, and other irritants can also cause bronchitis.
What about allergies? Could that be it?
Allergies can cause similar symptoms, but with bronchitis, you'll typically have a persistent cough, often with phlegm, along with fatigue and chest discomfort.
That sounds exactly like what I'm experiencing, and the chest pain is worrying me.
The pain usually worsens with coughing. It's due to the inflammation in your airways, not your heart, so try not to worry too much.
Okay, that's reassuring.
While most cases of acute bronchitis clear up on their own, it's essential to monitor for any complications, especially if you have other health conditions.
Complications? Like what?
In some cases, bronchitis can lead to pneumonia, a more serious lung infection. This is more common in people with weakened immune systems.
I see. So it's important to get it checked out just in case.
Exactly, Dr. Smith affirmed. He continued, when it comes to treating acute bronchitis, the approach is often more about managing symptoms and supporting your body's natural healing process rather than using aggressive treatments. Fortunately, treatment for acute bronchitis is usually straightforward. Getting plenty of rest, staying hydrated, and using a humidifier can help alleviate your symptoms. Rest is crucial because it allows your body to focus its energy on fighting the infection. Hydration helps thin the mucus in your lungs, making it easier to expel, and a humidifier can soothe irritated airways. In addition to these basic steps, there are other home remedies that can provide relief. For instance, drinking warm liquids like tea with honey can be soothing for your throat. Over-the-counter medications such as cough suppressants and pain relievers can also be helpful in managing symptoms. However, it's important to use these medications as directed and consult with your doctor if you have any concerns.
What about antibiotics? Sarah asked, her brow furrowing with concern. She had always thought antibiotics were the go-to solution for infections. Sarah asked, remembering a time she was prescribed antibiotics for an infection. She recalled how quickly they had worked to clear up her symptoms and wondered if they might be necessary now.
Antibiotics are only effective against bacteria, Dr. Smith explained. Since yours is likely viral, they wouldn't be helpful in this case. In fact, using antibiotics when they're not needed can contribute to antibiotic resistance, which is a growing concern in the medical community. Since yours is likely viral, they wouldn't be helpful in this case. Dr. Smith showed Sarah a chart illustrating the differences between bacterial and viral infections. See here, he pointed, viral infections like the common cold or bronchitis typically resolve on their own with supportive care.
So, rest and fluids are the best course of action? Sarah asked, seeking reassurance. She wanted to make sure she was doing everything possible to recover quickly. Sarah confirmed, feeling a sense of relief. Dr. Smith nodded. Yes, and if your symptoms persist or worsen, we can explore other options. But for now, focus on taking care of yourself. Listen to your body, and don't hesitate to reach out if you have any questions or concerns. Sarah left the consultation feeling more informed and empowered. She had a clear plan: rest, stay hydrated, use a humidifier, and try some home remedies. She felt confident that with these steps, she would be on the road to recovery soon. Over the next few days, Sarah diligently followed Dr. Smith's advice. She set up her humidifier, made sure to drink plenty of water, and enjoyed warm cups of tea with honey. She also took over-the-counter medications as needed to manage her symptoms. Gradually, she began to feel better. Her cough lessened and her energy levels started to return. By the time her follow-up appointment came around, Sarah was feeling much more like herself. She was grateful for the simple yet effective treatment plan that had helped her recover without unnecessary medications. At her follow-up appointment, Dr. Smith was pleased with her progress. "You've done a great job taking care of yourself, Sarah," he said. "Remember, sometimes the best medicine is simply giving your body the time and support it needs to heal." Sarah left the doctor's office with a smile, feeling empowered by the knowledge that she could manage her health effectively with the right information and support. She knew that if she ever faced bronchitis again, she would be well prepared to handle it.
Yes, but to be certain, I'd like to listen to your lungs, Dr. Smith said, picking up his stethoscope. He had a calm and reassuring demeanor, which helped put Sarah at ease. The room was quiet except for the soft hum of medical equipment in the background. Dr. Smith's experience and confidence were evident in his every move, making Sarah feel she was in good hands. This will help me confirm the diagnosis and rule out anything more serious. It's important to be thorough, especially when it comes to respiratory issues. Dr. Smith explained that listening to the lungs can reveal a lot about a patient's condition. He mentioned that certain sounds, like wheezing or crackles, could indicate different types of respiratory problems. By carefully listening, he could determine whether Sarah's symptoms were due to a common illness like bronchitis or something more severe.
Okay, Sarah agreed, taking a deep breath as Dr. Smith listened to her breathing. She felt a bit nervous but trusted Dr. Smith's expertise. As she inhaled deeply, she could feel the cool metal of the stethoscope on her back. Dr. Smith moved the stethoscope to different areas, asking her to breathe in and out slowly. Sarah followed his instructions, trying to stay calm and steady her breathing.
Your lungs sound congested, consistent with bronchitis, Dr. Smith concluded. He explained that bronchitis is an inflammation of the bronchial tubes which carry air to the lungs. This inflammation can cause coughing, mucus production, and difficulty breathing. Dr. Smith reassured Sarah that while bronchitis can be uncomfortable, it is usually not serious and can be treated effectively with medication and rest. I'll also order a chest X-ray to get a clearer picture and rule out pneumonia. Pneumonia is a more serious condition that can develop if bronchitis is left untreated or if the infection spreads to the lungs. The chest X-ray will help us see if there are any signs of pneumonia or other complications. Dr. Smith explained that the X-ray would provide a detailed image of Sarah's lungs, allowing him to make a more accurate diagnosis.
Thank you, doctor, Sarah said, feeling reassured by his thoroughness. She appreciated the time Dr. Smith took to explain everything in detail and his commitment to ensuring she received the best care possible. Sarah felt more confident about her treatment plan and was grateful for Dr. Smith's expertise and compassion. She knew she was in good hands and felt hopeful about her recovery.
While we're waiting for the X-ray results, let's talk about prevention, Dr. Smith suggested. Prevention is a crucial aspect of maintaining good health and avoiding illnesses. It's not just about treating symptoms when they arise, but about taking proactive steps to ensure you stay healthy in the first place. Prevention can save you from a lot of discomfort and potential complications down the line. Washing your hands frequently is crucial, Dr. Smith continued. Hand hygiene is one of the simplest yet most effective ways to prevent the spread of infections. When you wash your hands, you remove germs that you may have picked up from surfaces or other people. It's especially important to wash your hands before eating, after using the restroom, and after coughing or sneezing, especially during cold and flu season. During these times, viruses are more prevalent, and the risk of getting sick increases. Using hand sanitizer when soap and water aren't available is also a good practice. Make sure the hand sanitizer contains at least 60% alcohol to be effective.
I'll definitely be more diligent about that, Sarah promised. I've always known that hand washing is important, but I didn't realize just how crucial it is, especially during the colder months. I'll make sure to carry hand sanitizer with me and use it regularly. Anything else I can do? Sarah asked, eager to learn more about how she could protect herself and her family from getting sick.
Avoiding close contact with sick individuals, Dr. Smith advised. This means keeping a safe distance from people who are showing symptoms of illness, such as coughing or sneezing. It's also a good idea to avoid large gatherings during peak flu season, as the virus can spread quickly in crowded places. Covering your coughs and sneezes, Dr. Smith added. When you cough or sneeze, use a tissue or the inside of your elbow to cover your mouth and nose. This helps prevent the spread of germs to others. Dispose of the tissue immediately and wash your hands afterward. And getting your flu shot can significantly reduce your risk, Dr. Smith advised. The flu vaccine is designed to protect against the most common strains of the flu virus each year. It's recommended for everyone, especially those who are at higher risk of complications, such as young children, elderly individuals, and people with chronic health conditions.
I'll keep all of that in mind, Sarah said, feeling more informed and prepared. I didn't realize there were so many simple steps I could take to protect myself and my loved ones. I'll make sure to get my flu shot this year and encourage my family to do the same, Sarah said, determined to stay healthy. Prevention truly is key. And with these tips, I feel more confident in my ability to stay well during the cold and flu season.
Remember, Sarah, acute bronchitis is usually a self-limiting illness, Dr. Smith reassured her. With rest and care, you should start feeling better soon.
Thank you, doctor, Sarah said, her earlier anxiety replaced with a sense of hope. I feel much better knowing it's treatable.
And if your symptoms worsen or you have any concerns, don't hesitate to contact us, Dr. Smith added, offering a reassuring smile.
I will, Sarah promised, feeling grateful for his expertise and kindness.